Hi, I'm Diane Degnan of United Methodist Communications. Welcome to the Digital Lounge. Our guests today are Linda Bales Todd and Don Messer. They're co-chairs of the United Methodist Global AIDS Fund Committee, and together they make a great team. Both Linda and Don are longtime messengers and advocates to help raise awareness about the realities of HIV and AIDS and working together to give people hope. Linda, Don, welcome. Thank you for joining us.
Thank you.
So, Linda, we'll start with you. I understand that there was a conference yesterday, and part of your message is AIDS is not over. Are people becoming complacent about AIDS and not getting as much attention as it has in the past?
I think there may be a level of complacency at work. I think for one thing, more and more people are accessing drugs if they are positive, which means their lives are extended. And so we're not seeing as many people die of HIV or AIDS. And I think that's particularly true in the United States, where more and more people have access to health care and drug treatment. So I think if you're not seeing and hearing about people dying daily of AIDS, even though that does happen around the world, but particularly here, not so much in the United States, people can reach a level of complacency around the issue. At the same time, there are still millions of people out there who need our help, who are committed to the issue, who are working on this every day to try to make a difference and save people's lives. So it's kind of a both and.
Now, Don, I know you've been working tirelessly around this issue for decades, really. What are some of the obstacles that you've seen, and how have they changed over time?
The biggest obstacle from the beginning and until today has been stigma and discrimination. HIV, from the very beginning, became a very stigmatized disease, so that people infected and affected have been judged oftentimes as immoral by the church and other groups, or they have been feared by people, that people don't have appropriate education about how the disease is spread. So that even today, 30 some years into the pandemic, HIV and AIDS is one of the most stigmatized diseases in the world. It's still secret, and silence prevails even among families and certainly among churches and communities of faith as people struggle to deal with it. So that's the number one obstacle. Number two obstacle has been that there's never been enough money to deal with the issue appropriately. The church has not made it a priority over the years, so that the amount of money to deal with the nearly 25 million orphans out there still remains a big gap in services. The issues of poverty that are caused by people who are sick and don't have care. The whole matter of prevention has been difficult because of stigma. People don't get tested, and because they don't get tested, they don't get treated. Because of stigma, people don't use condoms and other means of prevention. So stigma tends to be the biggest obstacle in every respect, whether it's funding, prevention, care, or treatment.
Well, besides being the day before General Conference, when you had your HIV and AIDS conference yesterday, it was also pretty appropriate because it was the day after Mother's Day. And you've been working on the issue of preventing mother-to-child transmission of HIV and AIDS. How has that been going?
I think it's been going well. Everyone is concerned about mothers and children, and certainly not wanting to see newborns born with the HIV virus. So there's a lot of energy around this issue. Every day, about 900 babies are born around the world with HIV, and it's preventable. And so there are fairly effective and efficient ways to prevent that. It's just a matter of getting the word out, addressing what Don just said about stigma, making sure mothers are tested so they know their status, and then the availability of drug treatment if they are positive. So we, through the Global AIDS Fund, have funded a number of projects around the world that are addressing this issue, and it's really making a difference. Mothers are now getting tested, and they have peer groups that are supporting them. And so we are making a difference, but again, there is always more to be done.
So what were some of the other highlights of the conference, Don? What were some of the things that you talked about yesterday or that you heard from people?
Well, we began the conference with Bishop Palmer giving us a stirring address based on familiar scripture of the Good Samaritan, in which he you'd think we've had all the versions of the Good Samaritan in our churches, but Bishop Palmer, who was giving the Episcopal address, came to our conference and gave another special address about the Good Samaritan. He said the Good Samaritan saw a person in need, he stopped to help that person, he stooped down and cared for him, and then finally served and gave money, his own money, the Good Samaritan did, to help people. He wasn't just passing a resolution, but actually doing something. So that was a real high point. We also heard Pauline Machina from Kenya talk about the emerging issues that face us in this day and age about HIV and AIDS, young people who are getting infected, persons who are aging and the new impacts on that, the whole issues of sexual orientation in Africa, the questions of mental health of young people who are coming of age and they're living with HIV. What does that mean? She listed a whole number of emerging issues that are really vital to the future of the United Methodist Church's involvement on HIV and AIDS.
I know you've both traveled extensively and you've seen a lot and worked with a lot of programs closely. Do either of you have like a personal story that would illustrate how the work of the United Methodist Church is making a difference?
I'd like to jump in and tell that story because we're really encouraged that the United Methodist Church is picking up on the theme of mother to child, and the General Board of Global Ministry is going to make this a big emphasis in the quadrennium ahead. But work that we began has really made a difference. For example, money that we received through the United Methodist Global AIDS Fund through a church over the years started a clinic in India, a free clinic for women and children. And last January when I was in India, I met 2 of the children who were born HIV-free. As Linda said, up to 900 children are born every day HIV positive. We could have no HIV. We don't have any children in America born anymore with HIV, but it's still happening in the world. But because of this free clinic, the mother and the father, in this case, were able to get the correct training. The mother's HIV positive, but because of the use of medicine and care and proper information about breastfeeding, these 2 children are alive, vibrant, and HIV free. That was wonderful, holding those children in my hand and thinking, wow, because of the United Methodist Global AIDS Fund Committee and because of that local church, because people cared, these children are alive. I mean, these children don't know this, but we need to know it, that our work does make a difference in the lives of individuals.
Linda, I know that the Global AIDS Fund is going to be reporting to the General Conference next week about your work, but you also have something else going on. Could you tell us a little bit about the memorial service that's planned?
Sure. We have a memorial service planned for tomorrow on the North Plaza at 12:45, right when the session adjourns. It'll be about 15 minutes, a time for remembering those people who have died of AIDS, and we believe it'll be an important tribute to them, and also, again, lift up the importance of the issue of HIV and AIDS before the church as a denomination, and that we need to be actively involved in this issue and begin doing more to save people's lives.
So I know the Global AIDS Fund works around the world, but part of the money that's raised is also used in the U.S. Is that true?
That's correct. If a person in a local church contributes to the United Methodist Global AIDS Fund, 25% of that contribution stays in the annual conference in the United States. And that money then supports vital ministries for people living with AIDS or prevention of AIDS. And for example, there are a number of annual conferences that have retreats, one of which is called Strength for the Journey. And these are times when people living with AIDS can come together, they can find hope, they can find love and care and compassion, usually over a weekend. And it really brings new life to people who at times experience that stigma and discrimination, something we want to eliminate and bring healing. So again, this is one way that the Global AIDS Fund is really making a difference in people's lives.
I want to thank you for all you're doing, and I want to thank you for taking time to stop and share with us a little bit about this work this morning. That wraps up for this edition of the Digital Lounge. We hope you'll come back and check for more interviews with newsmakers and folks behind the scene here at the United Methodist General Conference in Portland, Oregon. Thanks for joining us.